Please do put your hands together as I welcome our esteemed panelists, Professor Dr. Ashok Seth, Chairman, Fortis Escorts Heart Institute, Chairman, Fortis Healthcare Medical Council. Please do welcome Professor Dr. M. Wali, former physician to the President of India, Senior Consultant, Sir Gangaram Hospital, Principal Director, Pacific One Health, Medicine and Preventive Cardiology. A round of applause as we welcome Professor Dr. Ambrish Mithal, Chairman of Endocrinology, Max Healthcare. What a delight having our esteemed speakers. Weaving all of this together will be Dr. Mamta Jain, Managing Director, Medwiz Healthcare. What she's done in the world of medicine and healthcare, especially when it comes to being a part of all her clients, is amazing. So may I request all of you to please put your hands together as we thank her for joining us, and also thank the team at Medwiz for being our knowledge partners. And with our wonderful speakers here, I think each one of us will have a lot of learning. So over to you, Dr. Jain.
Thank you, Isha, for such a wonderful introduction. You made my job easy. You know, healing, leadership, legacy, that is what it. And the audience should be aware of it. Between these three masters, we probably have 125 or 150 years of practice together combined, maybe more, but that's what the legacy is. And taking it from this very interesting session today, and in this era today, the fast-changing pace, and how you all three have seen it across, how it's evolved. We want to understand how it has changed and taken it across. I'll start from you, from left to right, nothing in preference because I like all three of you so much. Professor Seth, you came down to India in 1988. When the cardiology scenario here was just there, not there, we don't know. And you've trained in India more than 500 cardiologists, maybe more, I don't know, I'm getting the numbers wrong because over the period of years. What has changed? I mean, what did you bring into the table in the world of cardiology in India? And today when we had Minister also saying that we are viewed globally and we have a lot of medical tourism coming in. And what would you still want to change?
Right. Firstly, of course, I hope you're not disappointed. You invited three senior-looking, bearded, intelligent, very senior gentlemen, and one of them, I forgot my beard, I'm sorry, at home. So let me not disappoint you. And you know, when you ask that question, what did you really bring to India and what did you actually do? Sometimes it seems like a self-praise society in a way. But let me just put it really candidly, what the country anyway knows and accepts. There were 3 or 4 things that I did bring to India. When I returned after 10 years abroad, came back from England in '88, there were only 7 of us who were doing angioplasties, and it was a primitive early days of angioplasty. In fact, most of the country was going abroad at that time for treatment heart disease, whether it was Houston, whether it was England, even angiograms were not being done. Well, there were 4 things very easily. Firstly, brought back those techniques and technologies for India, which had never been seen in India before, which weren't even available. Sent benchmarks, not just for India, but for the whole of Asia Pacific. एक मैंने कहा था जब आया था कि जो वर्ल्ड में होता है ना, जो अमेरिका में होता है, उसको हिंदुस्तान में करना. And that was the first step. The second step, that as I was pushing boundaries with new devices and techniques being made available to India, was how do I train more Indians? And right from the second year onwards, we created a teaching program, a formal teaching program, these 7, 8 of us. And anybody who's anything in India does angioplasties has actually been trained by us. Wow. So that was the second point, and one of them today you saw was Dr. Ashwin Mehta, who was here today, yes, and Dr. Kaul. The third thing we did, which I did, clearly was train the whole of Asia Pacific. We were pioneers in what was happening, because anything in the West, we could do it, and we trained not just Asia Pacific. I have 51 formally trained fellows in Bangladesh. The whole infrastructure of Bangladesh was created by me of interventional cardiology. And that goes for Indonesia, Philippines, Singapore, Malaysia, China. I went to China and trained in angioplasties, those individuals. And finally, I'd say in the more recent times, it's been innovation. I helped India to create indigenous devices and stents, put them through first-in-human trials so that they became a standard of care even in the West, with trials in the West. And those were very seminal efforts of mine along with the medical device industry. So in a way, I am privileged to have put India on a world map in a manner that world understands our expertise, our intelligence, our knowledge, our science, and our innovations from that day to day. And as a byproduct, it's fair to say, and I think every cardiologist knows it, for the last 3 generations, any doctor who wanted to be a cardiologist or any cardiologist who wanted to be an interventional cardiology actually said that I'm going to become an Ashok Seth.
A big round of applause here. I mean, this is exactly how legacies are created. Coming down here right from the second year, planning to train people, setting it across not just in India, across our neighboring countries, establishing innovation, getting our own devices getting approved globally. And now again, where I think you set up gold standards for India in cardiology care. That's something, a big legacy. Now coming down from surgical, I would want to come down to Dr. Mithal, Professor Mithal, for you. With you, every patient that comes in, you've been there from vitamin D to diabetes care to endocrinology, you name it, and in the endocrinology, you have been a forerunner. But the patients who come to you are always chronic. They're not cured. How do you, this chronic diseases, healing versus cure, how do we take it across? That differentiation, and in India especially, because you've seen from not so high incidence of metabolic disease today where we are sitting as world capital. These are very pertinent questions that you can take it across.
So I'll first answer your question about chronic disease. So it requires a different mindset to be a chronic care physician versus someone who's doing active intervention or surgical procedures. It's almost like 2 parallel worlds. And why do I say that? I always joke with my surgical colleagues, especially orthopedic surgeons, that the best patient for you is someone who does not come back. That is the worst patient for us. That means he did a very bad job. The more the patient follows up regularly, the better chronic care physician you are. So, yes, so when healthcare develops, it's always the acute care that develops first. The procedures and the surgical procedures. But the understanding in the public about going to physicians for chronic care comes later. It's always a part of education, awareness, evolution. I think there is the main role of chronic care is to prevent acute events. The better job we do at prevention, the less work our surgical or intervention colleagues will have. That is actually the ultimate goal. So if you manage osteoporosis well, you'll have much less hip fractures. If you manage diabetes well, you have much less renal transplants or even bypass surgeries. Yeah. So I think chronic care is a way to prevent acute events from happening. And that's how you have to understand the value of chronic care, because sometimes it seems that, after all, what is a chronic care physician doing? He didn't put in a stent. He didn't sort of do anything major for me, but he has prevented you from getting there. So I think that is the understanding of chronic care. The other thing that chronic care allows you to do, and especially in our country, I always say, if you're planning to be a physician, especially a chronic care endocrinologist or whatever, you have to like people. Because you have to deal with hordes of people from morning till evening. And if you're a, leave me alone kind of guy who likes his computer screen or likes his tools or technology all the time, you would get very upset by the middle of the day. So you have to like people, you have to like to connect with people, you have to like to build bonds with people. I think that is the biggest thing. And in India, that is particularly unique because sometimes the general practice, general physician concept takes a back seat in India. We're sort of undergoing a transition. The GP care has, I mean, not many people are going into GP care, many doctors. So as a result, specialists who are practicing chronic care have to provide the GP component also. So I think you're bonding with families, the gratitude you get from them, the lifelong association is very gratifying. You followed up somebody for 25 years for osteoporosis, no fracture, amazing. Followed up somebody 30 years for diabetes, no complications, amazing. So that is one part of the story. The other part of the story, how chronic care has evolved very quickly. Similar to Dr. Seth, when I joined the endocrinology program at AIIMS in 1984, I was the first to join that program. So the thing is that India was producing 1 to 3 endocrinologists per year in the 80s. 87 is when I graduated in endocrinology. And over the years, 2 fundamental things happened. Number one, of course, there was an explosion of metabolic disease, so more endocrinologists were required. But the other thing that really happened was advances in technology, in investigations. It changed it completely. It seems very funny when I tell my students that a TSH result used to take 4 weeks. And we used to do it ourselves. It's a big thing. Collecting samples, running them once a month, that kind of thing. Patient comes back next month. Till then, you deal with him like, whatever your clinical impression is. So, to a fact, when it takes an hour or 2 hours. So, changes in technology, hormone assays were the first to completely change endocrinology. And now, with genome testing coming in, our ability to diagnose difficult cases has improved dramatically. Our radiology has always been at par. Our surgeons have always been fantastic. It was the investigations that were hampering us. So that is why endocrinology has boomed. And just to put it in perspective, the last sentence, that now India produces about 150 endocrinologists every year, from 2 or 3 or 1 sometimes. So there's been a huge change in the field, and it's been a tremendous journey, which I have thoroughly enjoyed.
Thank you so much. Coming to Professor Wali, you have been 50 years into practice and fortunate enough to be treating across 3 presidents of India. You were the personal physician of that. Treating president of India or the dignitaries and treating a common man. Does the bedside, this is a secret we are asking because everyone would be probably treating someone. You have all of it. Does it change? Are these patients different? Would you take it across different? How does it matter?
Thank you, Mamta ji, and thank you, Times Now Group. First of all, I feel humbled sitting in between 2 dons, and out of them, one of them is my savior. I give you an example why I mentioned this. When Dr. Seth did my angioplasty few months back, angiography, he came to my bed more than 2 times. This was my 3rd angiography, and in previous 2 angiographies, nobody came to me. So I again today thank him for doing that. This is what is care. And this care brings that touch which Ambrish was talking. And you said president is a citizen of the country, also as defined. President is an institution. And to my bad luck or good luck, this question was asked by President Venkataraman in my interview, who himself took my interview because he was not happy with his previous 2 doctors. And he straight away asked after 2-3 questions, how would you treat me? And I was quite young at that time, running in my late 30s. And as a young man would answer, I said, like any other patient, sir. And that immediately I realized I was talking to President of India. Then I gathered myself and said, regard of you being an institution as president will remain in my heart, would not go to my brain. And this finished my interview, and he change the interview from monologue to dialogue, and he starts narrating his own experience, worst experience, and some bad experience with some of his my predecessors. So everybody wants to be treated like a human being, and a patient who is not president and a patient who is president, this line goes away when disease attacks or disease comes in. So then the things which matter are empathy, cooperation, applying the wit, and discharging your best at that given time, because whomsoever is the patient, he is in agony, anxiety, and in a hope to get well, and we are there to complete that hope. So the duties, as Honorable Minister was also described, and I fully agree with what Ambrish said just now. It's a bond, it's a compassion, it's empathy, it's feeling responsible. We handle lives. That is all doctors. We handle lives. We don't do experiments. So when we are handling lives, we have to do our best and leave rest to the God. I tell you, and I tell this audience, that we are human beings and we are bound to commit mistakes, and mistakes can happen. It's only God who saves us. And sometimes our mistakes are not disclosed. So even then God saves our mistakes. So both ways we should be very much connected, and then the connection which Ambrish was talking, the patient gets connected to us. I am telling something spiritual or something beyond which normal people will talk. But this is the truth, this is the secret of success, and this is what I follow. Thank you very much.
Thank you, Professor. So nicely said. I mean, every patient is same, and that empathy is what I gather from all of you three, that it makes the difference, and the passion. Coming down to you, Dr. Seth, and Dr. Ambrish Mithal did highlight it, that how the hormonal assays change, how the technology coming in, the diagnostic process, everything. Cardiology per se, intervention cardiology, has seen maximum, what do you say, now the AI driven, but if you see from the technology perspective, in invention perspective, everything. And you've been like a forerunner, seeing everything, embracing everything, learning everything, and then probably teaching also every day on that. What do you think has succeeded great ways, and something that you think could have been done better in Indian perspective, or we could have done better? Because this change, because of innovation, is going to be constant. How we as Indian physician be better prepared for it, adapt, not adapt, what do we do right? Because you have been there, now seen it all.
Yeah, I think let me just say that it's a very important question as to how the technological advances get fitted into the Indian context, should we say. And by the way, what I was doing 30 years ago, what I was doing 25 years ago, I may have been creating breakthroughs in being the first to do many things in this part of the world. But all that, even today, what I was doing 15 years ago is outdated. That's how fast technology has moved. But I think it's only relevant if that technology becomes accessible to the common man, available to the affordable. And I think what we've really done, which I think is very important to understand, is I think there are two aspects to it. One, of course, let's not make this science and these advancements of science which make us feel today that we are curing people. It's not true. We as doctors have become gods in some ways, because I can replace a valve of a heart valve without surgery in a patient who may be so serious that he may not survive in 48 hours, and come out and say, "Aapke ko bacha liya. Aapke pitaji ko bacha liya." Almost like an adulation that I could expect from the family. Yet, what is most important is that we haven't even scratched the surface of this human body. The greater that we become, the greater he becomes, the more we realize that we actually do not understand this human body. And our pedestals that we stand on are literally make us feel like a common man, to tell you frankly, a human being. Correct? I mean, COVID showed it to us that the numerous Nobel laureates put together, the world's brains put together, were reduced to a nothingness by a minuscule, invisible particle. And that's it. So that's the first point that I want to make, that we will have to live in our humility of any achievements. But the more important aspect is, like I said, how do you make it available? So if I look at the fact that it's nice that many of our trainees now are going to tier 2 and smaller cities, because the issue is not providing interventional care, but the issue is, can we provide that care with quality? AI can actually help them to make it quality. Our education and our CMEs can help them to provide care with quality. And more importantly, it can go downstream. But what is even more important is now prevention. Preventive care is the crux of what India will have to be to prevent diseases which are lifestyle disorders, be it diabetes or be it heart disease, or any infectious disease, whatever we're talking about, is all going to be preventive. And if AI, all these fascinating aspects, I was giving a lecture to literally 800 students who had, in a hackathon, come out with ideas of AI in healthcare delivery. Believe you me, most of those ideas could be capitalized on in terms of how much money could have been made from that. But I said, your mind is going in the wrong direction. My idea would be, the one which would win the award is how could it influence the lives of somebody in the village and prevent him from having heart disease, or his diabetes could be controlled, or his hypertension could be controlled, because that would stop patients coming to us. And the second aspect I raised was, I said, isn't this weird that we live in an atmosphere where we can't prevent diseases and disorders to the fullest extent? AI could not just help us to do that, but AI as an enabler would be so responsible for what we can deliver to all of us. So our minds should now be thinking of not just affordability, accessibility, but actually changing this whole what we call democratizing healthcare. Get the healthcare to the common man in a manner that AI could be used for all of us. But it has to be quality care. It just can't be that हमने healthcare को तो पहुंचा दिया 1.4 billion, but अगर patient मर रहा है 3 हफ्ते या 4 हफ्ते बाद, if the patient is coming back to me for a retreatment, then I haven't provided him quality care. And the measurement of quality care matrix for every doctor in this country should be, does the patient stay out of the hospital and doesn't come back for the next year, for the next 2 years? Because we should not have patient come back to us after we've treated him. We should be caring for him because we've given him the right treatment. Value medicine has to be delivered. That is the future of our country.
So rightly said, and that's how we should be progressing. And you brought across a very important point about AI preventing rather than just making money. I mean, we have to come out from that mindset. Professor Mithal, what would you want to add that when you were growing up in all of these years, something which has done very well for India and something where we could have done much better? You're not very happy the way it has gone, like be it chronic disease, the way we've just gone up.
So India is a land of paradoxes, and there are many Indias within India. We should remember that. On the one hand, we provide the highest end care that Dr. Seth is talking about, or he provides. And patients, as the minister was saying, come here from neighboring countries for the highest sort of level of surgical and medical care. On the other hand, we are still struggling with basic nutrition. What about nutrition? I mean, we talk of so many things. When you look at longevity worldwide, what improves longevity? Longevity is improved not by high-end procedures. That's only the last 2-3 years. What really changes things is, number one is vaccination, where we are doing pretty well, I think. So that's a great thing. The other is combating infection. And the third is nutrition, and they are linked, nutrition and infection. So I think we need to focus a lot on proper nutrition. On the one hand, 30% of our children, are still malnourished or growth stunted. Yeah. On the other hand, children living in cities are obese. So, I mean, there is a huge gap there, which is unique in a way to our country, and not a nice unique. But the fact is that it is there. And the fact is that we have to have strategies where we can address those issues together. So when we are eradicating malnutrition or removing poverty, we have to ensure that the kids eat the right stuff so that they don't become the obese urban children. So I think that is a gap. So on the one hand, we have really advanced a lot. On the other hand, the gap between those who have the highest end of care versus those who are relatively remote, while a lot of effort is being made by the government to bridge that gap, that remains a big thing. And at a more personal level, what happens when there is a lot of specialization, then sometimes the time spent with the patient and that kind of connect becomes difficult for a doctor who's seeing such a large number of patients. So that other thing, that empathy, that connect, sometimes, which I was talking about, is difficult for physicians to maintain. Easy for us to say, but sometimes difficult.
Professor Wali, I will come down to you with a question that you have seen generations as doctors who have been your students and taken it across. Now, one advice which you want to give it across to all the doctors here, what should they do, not do? I mean, something as simple as taking care of their own health, or whatever it is. I mean, your one point to all the doctors today.
I am a very strong advocate of following the ethics and of thing which our people are forgetting. You talk of technology, so we just seeing the generation change. A young doctor of today would prescribe an MRI if a patient like me goes to him for a headache. We were taught clinical medicine, and we were taught to touch the patient, to see the pulse. And I have written in my paper, 90% doctors forget about Ashok Seth. They don't see the pulse of the patient. They don't take the blood pressure of the patient. I'm sorry to mention this. This is my observation. And that is why we are losing the basic touch with the patient. You were asking what is the difference between seeing the president and seeing a normal person. The difference is nothing. If there is one thing which these 5 decades have taught me, is this: every patient deserves presidential care, not because everyone is a president, but because every human life carries equal dignity.
Absolutely. Thank you so much. There could have never been such an August. I mean, this is probably the definition of August gathering comes from this platform, and I have been very, very fortunate. I thank ET for this opportunity.
I know we want to finish, but may I just add that? I think what he said is very important. None of us would ever like to be known as the most proficient doctor. I wouldn't ever like to be known as kitna expert tha, kya kar leta tha. We don't want to be even known as, we don't even want to be known as a skilled or a famous doctor. There's nothing like a famous doctor. We just want to be known as a good doctor and finally a good man. And you know what that means is, we just have to have the 5 C's. He related that. Care, which is empathy. Haath pakad ke, 50% disease go with this. Even now, as we live in the fascination of science. Compassion, care, commitment, absolute commitment. Finally, there are only 2 things left. That's competence. We have to be updated every time. We've got to be competent. And there's conscience that we've got to live with, because that is what ethics is all about. We got to, if we do the right things to the patient, if that's a relative of ours sitting there, and we actually treat the patient as our own brother, sister, father, mother, then we know that we've done the right thing and we'll sleep well at night.
Absolutely.
And if we live this 5 C's, we'll just be a good doctor, and that's what we need to be.
Absolutely.
Nothing more than that.
And the way Professor has summarized, I have no other words to add it. And thank you so much. Thank you so much for this beautiful opportunity that you guys have given it across to me. Thank you, E.T.
Thank
Over
you
to
so
you,
very
Isha.
much. It's been a pleasure having you all join us. May I request all 4 of you to please join us for a group photograph as we take a moment